There is one drink sitting in most American kitchens right now that researchers at Harvard Medical School have been studying for over a decade, and most people who have it never use it correctly. They treat it like a trend, something they read about in a magazine. But what the science actually shows, when you look at the clinical data, not the headlines, is that this drink does something inside the body that no pill on the market can fully replicate. It targets the root cause of the condition that sits underneath almost every major disease killing Americans over 60 right now. And most people drinking it are missing the one thing that makes it work. Stay with me, because what I'm going to show you in the next few minutes is not something you are going to hear from most doctors, and the reason why might surprise you. My name is Dr. William Lee. I am an internal medicine physician and vascular biologist, and I have spent more than 28 years studying how food and drink affect the body at the cellular level, specifically how what we consume either feeds inflammation or fights it. I have worked with patients dealing with heart disease, diabetes, autoimmune conditions, and chronic pain. And what I have learned, what I see confirmed in my clinic every single week, is that inflammation is not just a buzzword. It is the single most destructive biological process happening inside the bodies of millions of Americans right now, silently, without symptoms, without warning. And there is one drink that addresses it more directly than almost anything else I have encountered in nearly 3 decades of practice. Stay with me, because what I am about to share with you is the kind of information I give my patients in the exam room. Information most people simply never get the chance to hear before it is too late. Before I tell you which drink this is and exactly how to use it, I need you to understand something about inflammation, because most people have the wrong idea about what it actually is. And that misunderstanding is exactly why so many people are fighting it with the wrong tools. When most people hear the word inflammation, they picture a swollen ankle or a red wound on the skin. That is acute inflammation, and that kind is actually your friend. Your body sends it in to fight an infection, repair a broken blood vessel, close a wound. It is short, it is fast. It does its job, and then it leaves. That kind of inflammation is the reason a cut heals in a week. Think of it like the fire department. Your body calls them in, they put the fire out, they go home, the whole thing is over in days. But after 60, and this is the part most people never hear, there is a second kind of inflammation that works completely differently. It is called chronic low-grade systemic inflammation. And this one does not get called in for an emergency. It never goes home. It just stays quietly around the clock. In your blood vessels, in your joints, in your brain tissue, in your gut lining, in the walls of your arteries. You cannot feel it. There is no redness you can see, no swelling you can touch, but it is there. And the research from the National Institutes of Health is very clear on this. Chronic inflammation is the underlying driver of cardiovascular disease, type 2 diabetes, Alzheimer's disease, certain cancers, and arthritis. According to the CDC, 7 out of the 10 leading causes of death in the United States are directly linked to chronic inflammation. 7 out of 10, that is not a coincidence. That is a pattern. And understanding it changes everything about how you protect your body going forward. Think of chronic inflammation like a slow gas leak in your house. You cannot smell it. You cannot see it. Your appliances seem to be working just fine. But day after day, the gas is building up in the walls, in the foundation, in places you cannot see. And one day, not because of anything dramatic, something gives. The patients who understand this are the ones who catch it in time. The ones who do not. They are the ones who end up in my office after the event has already happened. So let us talk about the drink, and let us talk about exactly how it works. The drink is green tea. And before you close this video thinking you already know everything about green tea, stay with me, because what most people know about green tea and what it actually does inside the body at the cellular level are two very different things. And the gap between those two things is exactly where most people are losing the benefit entirely. Most of my patients tell me they have heard green tea is good for them. Some of them drink it occasionally, some of them switch from coffee, a few of them take green tea extract in a capsule. And almost all of them think that as long as they are drinking it, they are getting the benefit. But here's what most people do not realize. Not all green tea is the same. Not all preparation methods deliver the same compounds. And the time of day you drink it matters more than almost any other factor. Let me explain what is actually happening inside your body when you drink green tea correctly. Green tea contains a family of antioxidant compounds called catechins. The most powerful of these, and the one that has been studied most extensively, is called EGCG, epigallocatechengalate. Now you do not need to remember that name. What you need to remember is what it does. EGCG is one of the most potent natural anti-inflammatory compounds ever identified in clinical research. When it enters your bloodstream, it does something extraordinary. It directly blocks a protein called NF-κB, which is essentially the on switch for the inflammatory process in your body. Most pharmaceutical anti-inflammatory drugs work by blocking one specific pathway. EGCG works upstream. It goes to the switch itself and turns the volume down on inflammation system-wide. Think of it like this. Imagine your body's inflammatory response as a sprinkler system in a building. Most medications go in and block one specific sprinkler head. EGCG goes to the control panel and dials down the water pressure in the entire system. That is why the research from Harvard Medical School and Johns Hopkins has consistently found that regular green tea consumption is associated with significantly reduced markers of systemic inflammation, including C-reactive protein, interleukin-6, and tumor necrosis factor alpha. Those are the exact same markers your doctor measures in a blood test to assess your cardiovascular and inflammatory risk. And according to a landmark study published through the National Institutes of Health, people who drank 3 to 5 cups of green tea per day had a 31% lower risk of cardiovascular disease death compared to people who did not drink it. 31%. That is not a small number. That is the difference between being here for your grandchildren's graduation and not. But here is the part almost nobody tells you, and this is where most people lose the benefit completely. The water temperature matters enormously. If you pour boiling water directly over a green tea bag, you destroy a significant portion of the catechins before they ever reach your cup. The ideal water temperature for green tea is between 160 and 180 degrees Fahrenheit. If you do not have a temperature-controlled kettle, and most people do not, bring your water to a full boil and then let it sit for exactly 3 minutes before pouring. That simple change preserves the compounds that make green tea work. This one habit adjustment alone changes the therapeutic value of every cup you drink from this point forward. Now, I want to pause here and ask you something directly. Have you been drinking green tea, or has someone you love been drinking it, but maybe not seeing the results you expected? If the answer is yes, go to the comments right now and type the word yes, just that one word, because I read every single comment on this channel, every one. And what I am going to tell you next may be the reason why. The second thing almost nobody talks about is when you drink it. And this is where the science gets genuinely interesting. Most people drink green tea whenever they feel like it, after dinner, in the afternoon, whenever. But research published through the American Heart Association shows that the anti-inflammatory effect of green tea is significantly more powerful when it is consumed in the morning, on a relatively empty stomach, before your first major meal. Here is why. During sleep, your body goes into a repair and recycling mode. Old cells are broken down. Inflammatory proteins that have built up during the day are processed. Your liver works hard overnight to filter what it can. When you wake up, your body is in a state of readiness. The cellular machinery is primed and receptive. Drinking green tea at this moment is like pouring fuel directly into an engine that is already warmed up and ready to run. The EGCG absorbs more efficiently. The anti-inflammatory signaling happens faster, and the effect persists longer through the day. Think of it like watering your garden. You can water it in the heat of the afternoon, but most of it evaporates before it reaches the roots. Water it in the cool of the morning and the same amount of water goes deeper, lasts longer, and does more good. That is what morning green tea does for your body's anti-inflammatory system. I want to tell you about a patient of mine. Her name was Dorothy. She was 71 years old, a retired nurse, which meant she had spent her whole career taking care of other people and not nearly enough time taking care of herself. She came in to see me about 18 months ago. She had been dealing with joint pain in her hands and knees for about 3 years. Her rheumatologist had put her on a low-dose anti-inflammatory medication, which helped some but not enough. Her blood work showed elevated C-reactive protein, a key marker of systemic inflammation, consistently above 4.0, which is in the high-risk range. Dorothy told me she had tried green tea before and gave it up because she did not feel any different. I asked her how she was preparing it, and when she was drinking it, she was using boiling water straight from the kettle, drinking it after dinner while she watched television, and she was using a generic supermarket brand in paper tea bags. I asked her to make 3 changes: switch to a high-quality loose-leaf Japanese green tea, adjust her water temperature, and drink her first cup in the morning before breakfast, just 1 cup, slowly, while the house was still quiet. We ran her labs again at the 6-month mark. Her C-reactive protein had dropped from 4.2 to 1.8. Her joint pain had reduced enough that she was walking her dog again every morning, something she had given up 2 years earlier. She told me in her follow-up appointment, "Doctor, I feel like I got a part of my life back." And look, I am not telling you that green tea cured Dorothy's condition. That is not what happened. What happened is that removing chronic low-grade inflammation from the equation gave her body enough breathing room to function better. That is what this drink does. It does not replace medical care. It supports the conditions under which your body can actually heal. If you have a parent, a spouse, a sibling, or a close friend over 60 who is dealing with joint pain, fatigue, brain fog, or has been told their inflammatory markers are elevated, I want you to save this video right now and send it to them when we are done. Not because green tea is a simple answer to a complex problem, But because the information I am sharing today is the kind of foundational knowledge that changes how people take care of themselves, and most people never get it, that one act of sharing might matter more than you realize. Now let me tell you about the third factor that almost no one discusses, and in my clinical experience, this is the one that makes the biggest difference of all. It is what you pair with your green tea, because green tea does not work in isolation. The anti-inflammatory effect of EGCG is powerfully enhanced by two specific additions that most people never think about. The first is a small squeeze of lemon juice. Here is why this matters. EGCG, the active compound in green tea, is not particularly stable in the alkaline environment of the digestive tract. Studies from Purdue University found that adding citrus juice to green tea increased the amount of EGCG that actually survived digestion and reached the bloodstream by up to 5 times. Think about that. You are drinking the same cup of tea, but by adding a simple squeeze of lemon, you are delivering 5 times more of the active anti-inflammatory compound to the cells and tissues where it needs to go. Most of the benefit that people are not seeing from green tea is getting lost in the gut before it ever reaches the bloodstream. A squeeze of lemon fixes that. The second addition is a small pinch of black pepper. Now this might sound unusual in a cup of tea, and you do not need much. We are talking a tiny pinch, but black pepper contains a compound called piperine, the same compound that makes turmeric dramatically more bioavailable. Piperine has been shown in research published through the National Institutes of Health to enhance the absorption of a wide range of plant-based compounds, including catechins from green tea. Think of piperine as a key that unlocks the door of your cells, so that more of what you are drinking can actually get inside and do its job. Think of it this way. You could have the best seeds in the world, but if the soil is hard and dry, those seeds sit on the surface and nothing happens. The lemon and the black pepper are what soften the soil. They are what allow the active compounds in green tea to actually reach the roots, your cells, your blood vessels, your tissue. And I want to pause here for just a moment because I think this is important. The reason I am telling you about the lemon and the black pepper is not to make this complicated. It is because I have seen too many patients dismiss green tea because they tried it and did not notice a difference. And in almost every case, almost every single case, the reason they did not notice a difference was preparation. They were losing most of the benefit before it ever reached their body. One squeeze of lemon, one small pinch of black pepper, that is the entire adjustment. Simple enough to do today, powerful enough to change what you feel 6 months from now. Now let me tell you about something that most people drinking green tea are completely unaware of, and it relates to when you should not drink it, because timing works in both directions. The same properties that make green tea so effective at reducing inflammation also make it something you need to be thoughtful about when taken alongside certain medications. Green tea, especially at 3 to 5 cups a day, can interact with blood thinners, specifically warfarin. It can reduce the absorption of certain iron supplements if taken at the same time. And the caffeine in green tea, while lower than coffee, can still affect blood pressure medications and certain heart rhythm medications in some patients. This is not a reason to avoid green tea. It is a reason to have a 5-minute conversation with your doctor about it, especially if you are on any of the medications I just mentioned. According to the Mayo Clinic, the most common reason that natural compounds create problems for patients is not the compound itself. It is the failure to communicate with a physician before adding it to a daily routine. That conversation takes 5 minutes, and it is always worth having. Think about someone you know right now, a neighbor, a close friend, a family member, who has been dealing with chronic pain, fatigue, or inflammation-related health issues for years. Someone who has been taking over-the-counter anti-inflammatories regularly, or who has been told their inflammatory markers are too high. That person needs this information. When we finish today, send this to them. That one tap on your phone might genuinely be one of the most useful things you do for someone you care about today. I want to step out of doctor mode for just a moment because there is something I want to say to you as a human being, not just as a physician. I have been doing this work for nearly 3 decades, and in that time, I have sat with patients after serious diagnoses, cardiovascular events, early-stage dementia, autoimmune conditions that had been quietly progressing for years, and the conversation I find myself having over and over again is always some version of the same one. They tell me, I wish I had known this sooner. Not one of those patients did anything dramatically wrong. They lived their lives, they ate reasonably well, they took their medications, they did what their doctors told them. But chronic inflammation, that silent, invisible, accumulating process, was running in the background the entire time. And nobody had taken 15 minutes to explain to them what it was, where it comes from, and what they could do about it every single day. That is the gap I am trying to close with everything I share on this channel. Not because green tea is magic, it is not. But because understanding the process, understanding why inflammation builds, what it does to your blood vessels and brain and joints over time, and what specific, simple daily habits actually address it, that understanding is what changes outcomes. I have watched it happen I have seen patients walk back in 6 months later with improved labs, less pain, more energy, and a look on their face like they finally feel like themselves again. That is what happens when people have the right information, and you deserve that information. You came here for it, and I am going to make sure you leave with it. So let us bring it all together. Here is what the research shows and what I tell every patient who asks me about green tea and inflammation. Drink 3 cups of green tea per day. Your first cup in the morning, before breakfast. This is when your body is most receptive and the anti-inflammatory compounds absorb most efficiently. Your second cup in the mid-morning or early afternoon. Your third cup in the late afternoon, not after 5 p.m. if you are sensitive to caffeine. Use water that is 160 to 180 degrees Fahrenheit, not boiling. If you do not have a temperature-controlled kettle, boil your water and let it sit for 3 minutes before pouring. Add a small squeeze of fresh lemon to every cup. This increases the bioavailability of the active compounds by up to 5 times. Add a very small pinch of black pepper. This enhances absorption further and amplifies the anti-inflammatory effect. Choose a high-quality Japanese green tea, matcha or sencha over generic supermarket tea bags when possible. The catechin content is significantly higher. If you are on blood thinners, iron supplements, or blood pressure medications, have a brief conversation with your doctor before starting a daily green tea routine. 5 minutes. That is all it takes. And finally, give it time. Inflammation does not build overnight, and it does not resolve overnight. Give this routine 90 days before you evaluate. Have your C-reactive protein checked at your next blood draw. Ask your doctor to run it if it is not on your standard panel. That number will tell you more about your inflammatory status than almost anything else in your labs. The patients who have turned this around, the ones who come back to my office 6 months later with better labs and less pain and more energy, they did not have better genetics than you. They did not have more willpower or more time or more resources. They simply had the right information at the right moment and they acted on it. That is the only difference I have ever found. You now have the information. What you do with it starting today is entirely up to you. If this video gave you something useful today, and I genuinely hope it did, I want to ask you to share it, not because it helps the channel, though it does, but because there is someone in your life right now who is dealing with inflammation-related health issues, joint pain, fatigue, high inflammatory markers, early cardiovascular concerns, and they have never heard any of what I just told you. Sharing this video is a 5-second act that could genuinely change what happens to their health over the next year. A husband, a wife, a parent, a sibling, a close friend, someone who deserves this information as much as you did, send it to them. That matters. Tell me in the comments right now which part of this surprised you the most. Was it the water temperature, the lemon, the timing, or was it something else entirely? Write it in the comments below. I read every single one, and I often respond. If you are not subscribed yet, hit that subscribe button and turn on the notification bell. Because next week, I am going to show you 5 specific foods that are silently feeding chronic inflammation in your body right now. Foods that most people consider healthy, including one that is on almost every American breakfast table every single morning. You do not want to miss that one. Hit the bell so you are there when it goes up. And before I go, I want to say something important. Everything I shared today is based on published clinical research and my experience as a physician. It is general medical information. It is not a replacement for your personal medical care. Before making any changes to your routine, especially if you are on medications or managing a chronic condition, please talk to your own doctor. They know your history. They know your full picture. And that conversation, honest, direct, and unhurried, is exactly where good medicine begins. I am Dr. William Lee. Thank you for being here. Take care of yourself, and I will see you next week.